Today, we're talking about fertility. For some women, becoming pregnant comes easy, but for others, their dream of becoming a mom is, it's more difficult. On today's show, we're talking with obstetrician-gynecologist Dr. Priya Sureddi Patel. We're going to discuss what fertility options are available and when someone should seek a specialist. That's coming up next.
Welcome to the Wellbeing DFW podcast. Each week, Scott Sams will cover a different topic on improving health and well-being in our North Texas communities. He will host interviews with physicians on the medical staff of Texas Health Hospitals.
I'm Scott Sams. Thanks for joining us today. The birth of a child is one of the most memorable events in a parent's life. But for some women, getting pregnant is a real challenge. Some get pregnant quickly, while others experience disappointment after disappointment. Our next guest is here with some hope for those struggling mothers-to-be. Dr. Priya Sureddi Patel is an obstetrician-gynecologist on the medical staff at Texas Health Presbyterian Hospital, Allen. She'll give us some insight on fertility and pregnancy. Dr. Patel, thanks for joining us today.
Thank you for having me.
I learned a fertility fact to start off with. At birth, women's ovaries contain all the eggs they'll ever need over their lifetime. Since a woman is born with all of her eggs, what are some of the factors that will impact, her ability to become pregnant?
So there are a myriad of factors that really play a role in this. I would say the biggest and most significant is really age at conception. So the age at which a woman starts trying to get pregnant. That tends to have the biggest impact on fertility. As well, other factors, things like polycystic ovarian syndrome, endometriosis, any other medical conditions the individual might have will also play a role in that.
As you mentioned, age is a key factor. Are there any typical ages when there's a natural drop in fertility, when it may become increasingly harder to get pregnant?
We'd like to think that age doesn't play a role in fertility, but unfortunately, the reality is that it does. I don't like to ever say there's a specific number where, over this age, it's going to be way more difficult. But statistically, we found age 35 and older, that's where you see sort of a significant drop in those fertility rates. That's also the age, typically 35 and older, where you start to see an increase in the rates of chromosomal abnormalities like Down syndrome, things like that. And so that's sort of the number we've determined to be a statistically significant number where we really start to see things decline and the rate of abnormalities increase. Not to say that at 35 or older than that you can't have a completely normal, healthy pregnancy, but that is when the numbers start to fall off a little bit.
My sister-in-law had her first child when she was 38. You can have children, obviously, after that.
Absolutely.
And we're hearing cases now where some celebrities are getting pregnant even in their 50s. Why are we seeing an increase in later in life pregnancies?
There's a few different reasons for this. I think one is that as women are participating in different things in their life, they're oftentimes engaging in different careers and in some ways often putting their career first. Mm-hmm. They're often thinking about getting pregnant later in their life. Sometimes they're also getting married later, and so that often delays the age of trying to get pregnant. As well as women are getting older, now artificial reproductive technologies have become a very available and accessible thing. 40, 50 years ago, that wasn't something that existed. So I think, that's allowing women to get pregnant even later in their life. And I think that's probably the most significant reason we're seeing an increase in the age.
Doctor, are there any tools or methods that a woman can use to be proactive to help increase their chances of becoming pregnant?
Yeah, absolutely. So first and foremost, you can use over-the-counter ovulation kits, just your local CVS, Target, Walmart, anywhere like that. There's several different brands. One's really not better than another. But typically what they can do is help you to track ovulation. The instructions are very self-explanatory, but you usually start the kits at a certain day of your cycle. Typically it's first morning urination, and it's very similar to a pregnancy test. But they'll help you to know when you're ovulating. Why that's so important is that when you're ovulating is when you can actually get pregnant. And so usually the kits will give you a peak fertility period, and usually you want to make sure you have intercourse on that day and the next day to really optimize the chances of getting pregnant. As well, you want to make sure you're maintaining a healthy lifestyle with good dietary habits, good exercise. You want to make sure if you're a smoker to quit smoking because that can actually help to enhance fertility and to minimize alcohol intake. As well, something we used to use more in the past is called basal body temperatures. You basically take your temperature first thing in the morning, and when it rises, it tells you you've ovulated. It's still a valid method, but it was more useful in the past before we had ovulation kits and things like that. Nowadays, ovulation kits are really the easiest way because it helps you know beforehand, so you can really time intercourse accordingly.
If a woman's hoping to get pregnant soon, what are some of the first steps that an OB would recommend?
So the first thing I tell anyone thinking about trying to get pregnant is to get on a prenatal vitamin. It's really important to make sure you're getting in adequate folic acid because even prior to knowing you're pregnant, which is typically at least at 4 weeks, that folic acid is still valuable in helping to prevent some of those pregnancy complications like neural tube defects and things like that. So first and foremost is to get on a prenatal vitamin. Usually also say it doesn't hurt to also supplement that with a little bit of DHA or omega-3 fatty acids. That can help with the brain development of the fetus, so that's also very valuable. And then basic lifestyle modifications. You want to make sure you're eating a healthy diet. Make sure you're getting 5 servings of fruits and vegetables in a day. Usually moderate exercise actually helps to enhance fertility, things like that. You also want to try to minimize alcohol intake. For smokers, you really want to work on tobacco cessation. That's been found to be one of the biggest risk factors, which with decreasing fertility, and then once you become pregnant, also causing complications in pregnancy.
Sure. Now, after following these suggestions, like the ones you just mentioned, how long should a couple wait before going back to see their doctor because they're concerned they haven't become pregnant yet?
So that's a really good question. Typically, we say for individuals under the age of 35, we usually like them to try regularly for about 12 months. What does trying regularly mean? That typically means trying every month, sort of with regular intercourse, which we usually say at least 2 to 3 times a week. We also recommend, if it's been several months, you're not having any progress and you're trying to be proactive, you can often use over-the-counter ovulation kits, things like that. And that's typically for women that are having regular cycles each month. For women that are not having regular cycles each month, typically we presume if you're not having a cycle, you're probably not ovulating. So we usually urge them to seek evaluation much sooner because first we want to get to the root of why they're not having cycles. Now, for women over the age of 35, if they're having cycles regularly every month, that threshold of time that we want them to wait is shorter. We usually only want them to wait about 6 months before seeking evaluation, and that's because the likelihood of having problems with fertility is a lot higher. And so we want to sort of be aggressive sooner.
What about fertility specialists? Is IVF the only option? Are there other procedures that an OBGYN like you could do in your office first?
So absolutely. IVF, what we traditionally hear as IVF is typically a last resort. And there's a whole host of things we typically try before we resort to IVF. So with the basic, your typical obstetrician and gynecologist, there's always a basic workup that they're going to do. Mm-hmm. They're going to want to check ovulation. They're going to want to check a series of hormone levels. They're going to want to do ultrasounds. Oftentimes they'll do what we call a HSG or hysterosalpingogram, which is a very complicated word, but it's basically a procedure that shoots some dye into the fallopian tubes to make sure the tubes and uterus and everything looks normal.
Okay.
So that's something that your OBGYN is going to do all of that themselves.
Okay.
So they are going to initiate the basic workup. We also like to look at the partner and consider a semen analysis and look at their health history. And, we always think of fertility as just the female, but actually there's 2 people involved in making a baby. And so, part of that workup includes looking at the female, but also looking at the male. And then once we complete the basic workup, if the situation seems complicated or if additional workup is necessary, then that's when we refer to the reproductive endocrinologist. And they don't typically start with IVF either. They'll also do an additional workup as they see fit. And then there's also something called intrauterine insemination, or IUI. And that is basically where you take some hormonal medications, but it's on a much smaller scale than IVF. And then they usually will transfer the sperm into the uterus in a small procedure in the office.
Okay.
So typically somebody will try 2-3 cycles of that IUI or intrauterine insemination before they go to the more invasive and aggressive procedure of IVF.
Do you mind if I ask you a personal question?
Absolutely.
Why did you go into this field?
So, interestingly, when I was in medical school, I always thought I wanted to do anything but OBGYN. My mother is actually an OB, and while she loved what she did, I always wanted to pave my own road and do something different. But, as I went through the different rotations and got exposed to the different fields, I realized that I really loved surgery. But I loved the longevity of care and the getting to know your patients on a personal level that obstetrics and gynecology offered. And it was one of the few fields where you got to operate, but you also got to follow patients through the different stages of life.
Right.
And I think it's amazing that you could be with your patients for 30, 40, 50 years.
Sure.
Some of them you follow through their teenage years, into their 20s, through their pregnancies, and then maybe even, as they go through menopause and postmenopausal stages. And I think it's just really amazing and a unique gift to really follow people through their lives.
Very fulfilling.
Very fulfilling, truly.
When you were growing up here in North Texas, did you know, now that I know that your mom also was a doctor, did you always know, was it just like second nature, you're going to be a doctor when you grow up?
It's funny because, people always ask that question, and you would think typically yes. But, my parents were always do what you love. Being a doctor, we love it. We find it fulfilling, but it's not a short road. It's a long journey to get there. And so they said you really need to love what you do. And whatever you choose, whatever that ends up being for you, if you love it, then it doesn't matter if it takes 12 years, 16 years, or 20 years to get there because you'll love it in the end.
Good point.
So I always tried to keep an open mind, but I think, without realizing it, I used to watch my mom go to deliveries. And even though sometimes I used to think she's getting up in the middle of the night, this seems miserable, she never complained. She always had a smile on her face.
Always liked it.
She always loved it. Whether it was 3 a.m. or, for 3 nights in a row, I could tell she always loved it. So I think maybe without realizing it, that affected me subconsciously.
Yeah. Favorite sports team?
Dallas Cowboys.
All right. Good to know. Thank you, Doctor. We appreciate you being with us this week.
Thank you very much. It was a pleasure.
And that'll do it for today. I'd like to thank Dr. Patel for joining us. We certainly appreciate her time. Texas Health is partnering with you for a better North Texas. To hear more Wellbeing DFW podcasts, visit our website at texashealth.org/podcast. I'm Scott Sams. Thanks for joining us.